Good morning, my name is Jonna Warden. I'm a nurse practitioner student, and today I'm going to be doing an abdominal exam, okay? Can you tell me your full name?
Tristan Warden.
Your birthday?
1/26/96.
Tristan is a 29-year-old healthy appearing male laying in supine position. He is well groomed and dressed appropriately for the situation. He appears to be in no distress, alert and oriented ×4, and is the primary historian for his care. Vital signs include blood pressure 130/80, heart rate 88, temp 98.1, respiration rate 16. He is 6'1" at 300 pounds, and he rates his pain as a 0. Alright, Tristan, for this exam, I'm going to stand on your right side, and we're going to do look, listen, and feel for the order, okay? Alright, so first thing I'm doing is inspecting the abdomen. I'm looking for color, which looks appropriate. I don't see any bruises or rashes. I do see a little bit of striae and some acne. The abdomen is symmetrical, and for contour, it is protuberant. And I don't see any aortic pulsations or any peristalsis. And I don't see any umbilical bulges, which would indicate a hernia. Next thing I'm going to do is I'm going to listen to your abdomen in all 4 quadrants for approximately 30 seconds each, okay? Next side. Alrighty. And lastly, alrighty, I was able to hear bass sounds at all 4 quadrants, and they are norma active. Next, I'm going to listen to your aorta. Your renal arteries. They branch right off the aorta. Your iliac arteries. I'm just going to lift here for your femoral. Very good. I don't hear any bruise in any of those areas, which is normal. Next, I'm going to listen for some friction rubs or some venous hums over your liver first. So there's approximately over here. Good. And your spleen. I don't hear any adventitious sounds in any of those areas. Next, I'm going to begin percussion. I'm going to go in 9 quadrants here, okay? I'm listening for the distribution of tympani and dullness. Very good. Next, I'm going to try to percuss the span of your liver. I'm going to start up here. Grab a ruler. Good. So liver span is approximately 6 centimeters, which is normal. Next, I'm going to percuss for any splenomegaly. So I'm going to start here. Percuss. Take a deep breath for me. Hold it in. Good. Relax. Percussion remain tympanic, which is normal. Next, we're going to start with palpation. So I'm going to have you lift your knees for me. Very good. I'm going to start with light palpation first. Now, when I remove my hands, you let me know if you have any pain, okay? Now, not only are we palpating for any masses or tenderness, I'm also checking for any rebound tenderness to make sure there's no peritoneal inflammation. Now, you do have a hernia on this side, correct? Okay, so that'd be a Spigelian hernia. Is there any pain when I remove my hands? Okay, very good. Now I'm going to start with some deep palpation again for any masses or any tenderness. You let me know if there's any pain, okay? Any pain in any of these areas that I'm deep palpating?
No.
No? Okay, good. Now I'm going to palpate for your liver. I'm going to use the hook method and start here at your belly button and work my way up. Take a deep breath for me. Hold it. Good. I was able to palpate the edge of the liver. Now we're going to do the same thing for the spleen. I'm going to use the hook method here. Deep breath, hold it in. Okay, good. Unable to assess the spleen, which is normal. Next, I'm going to palpate for your aorta. Aorta is approximately 2.5 centimeters in width, which is normal. Then we're going to palpate for your kidneys. I'm going to put one hand underneath and one hand on top. Deep breath. Okay. Side. Deep breath. Okay, I'm gonna have you sit up. We're gonna check for CVA tenderness. This way for me.
Awesome.
All right, next I'm just gonna strike your back here. Any pain when I do that? Good. Any pain? Okay. Go ahead and lay back for me. Now we're going to assess for Murphy's sign for cholecystitis. I'm going to have you take a deep breath for me in, and I'm going to palpate your upper quadrant here. Any pain when I do that? No, good. Next, I'm going to assess for appendicitis using the Rosing sign. I'm going to palpate your left lower quadrant. I want you to tell me if you have pain in your right lower quadrant when I do this. No? Good. Next, we're going to assess for So sign. I'm just going to lift your leg here. And you're going to tell me if you have any pain in your right lower quadrant. No, good. And then again, for the obturator sign, I'm going to lift your leg, bend your knee, flex it towards your belly. Any pain when I do that? No? All right, very good. So that's our abdominal assessment. Thank you.